Hello, everybody. This is Joe Freudenberger, CEO for OakBend Medical Center in Richmond, Texas, coming to you today with a Cup of Joe conversation around healthcare topics that, if you're not in the middle of the healthcare system, you might not be familiar with. I'm joined today by Dr. Sarfraz Aly, infectious disease. He has been practicing for 15 years and is our chief of staff, our director of wound care, and in charge of our infection control committee. So, Dr. Aly is going to be chatting with us a little bit about when wound care is called for. And for those of us who've had surgery, as I did recently, this is an important topic because we don't always know what our wound is doing, and sometimes professionals are the right resource to turn to. So, Dr. Aly, what would you tell our audience as to when it is appropriate to go in and see a wound care specialist?
So I believe when you have a wound at any point that you feel that it's not going the right direction, it's a fair game to say, come to the wound care center and give us and look at the wound to help us diagnose it, treat it, and heal it faster before it becomes infected.
Now, do we see a physician when we come into the wound care center, or do we see a nurse, or how does that work? And do I need to get it pre-authorized? I mean, what's the approach I need to take to get a wound care consult?
So most and everyone's approved through insurance companies, and you always see a physician. It depends on which discipline you need to see: podiatry, surgery, infectious disease. There's an array of specialists in the wound care center, so the nurses will patch you up with the type of wound you have, so that way you get the right attention.
And so, what does a wound care center do as opposed to me going in and see my surgeon, for example, post-surgically?
Sure. So surgeons are busy, post-surgeries doing other things, and they constantly overlook the wounds really quickly. And so what the wound care does is just gets focused attention on the wounds itself. And that's all we do. So basically, we don't have any other discipline. We look at the wounds, we make sure it heals well, faster, make sure appropriate dressings are placed, right combinations are done. And if you need antibiotics or if you need anything else, we have the subspecialists available in the wound care center to help us out.
Oh, wow, that's impressive. And so you can accelerate the healing of an incision or something by virtue of how you treat the incision and the surrounding tissue? Is that bottom line what wound care is all about?
Absolutely. So, things come out so faster out here, different designs of dressing changes, different applications of dressings. And most of us physicians who practice every day don't know. So we get this knowledge from people that do practice wound care all day long. So we know how to treat them faster.
Well, thank you so much for joining me.
Absolutely.
Thank you all for joining us today on A Cup of Joe, and I look forward to seeing you next week. Have a great day.